Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everybody, this is Will Sullivan with another episode of Let's Cover That with my co-host
Antonina Agrusa, and today we have with us Dr. Onyx Adegbola, the founder and CEO of Casa de Sante. Onyx, thank you so much for joining us today.
Thank you so much for having me.
Of course. So Onyx, tell us a little bit about Casa de Sante and how your background in healthcare led you there.
Hi, I'm just going to start off with my background. By the way of background, I'm a physician scientist. I've worked in pharma for over 15 years, and I had roles in ranging from drug development to medical marketing, as well as medical affairs and regulatory roles as well. I went from working in the pharma industry to being a serial entrepreneur and founding companies, including a biotech company, and presently I am the founder of CEO of Casa de Sante. So Casa de Sante is a virtual platform. We started off with supplements, resources, and apps for people who have irritable bowel syndrome, also known as IBS, with a focus on the low FODMap diet. The low FODMap diet is a diet in which IBS patients eat as few FODMAPs as possible, which are fermentable carbohydrates. And those carbohydrates are fermented in the gut and result in gas, bloating, and diarrhea, as well as constipation, which are all the symptoms of IBS. So we started off providing support for patients who have IBS on the low FODMAP diet. And in the course of doing that, we saw that there was a huge gap in the healthcare space for people with chronic gut conditions such as IBS. There's a gap in terms of their ability to access care when they need it. There's a stigma that comes with having IBS, as well as the impact of IBS on their lives. And so we pivoted recently to add on a virtual IBS clinic as part of our services. And the aim of Casa de Sante's virtual IBS clinic is to provide integrated care for patients with IBS, consisting of a GI clinician, a health coach, as well as registered dietitians.
So can you just kind of hopping into that, give us just an understanding of what does the virtual gut space look like right now? You're saying it's people are embarrassed, there's difficulty in access to care. Before you came out with Casa de Sante, what was that looking for, and the need, and then what's the differentiating piece that you're bringing? Is it just nobody's offering this at all, or how's that space look like right now?
There are a few companies right now in the space. The way we differentiate ourselves is that we're more high touch, high frequency service. So a lot of the companies out in the space are either a mixture of in-person and as well as apps or digital monitoring and that sort of thing. So it does tend to be expensive to provide in-care services in a high touch, high frequency fashion. But we feel that for patients with IBS, that's the best way to get their symptoms under control in a really quick and sustained manner. So we find that these patients, they don't necessarily want to interact with an app, and we have patients that use apps in the past, and we still have our apps. But we find that for patients who have intractable IBS, that they've seen a lot of doctors, and they haven't had that whole person assessment of their symptoms, and just coming up with a personalized plan that is reinforced through a dietitian and a health coach, as well as a clinician on an ongoing basis, is what they're missing. So I think there are patients that can be helped with apps. We've had a lot of patients use our apps in the past and find help from that. But for the set of patients who need more than just maybe an app as well as an in-person visit, but who need that high-touch, high-frequency visit and sort of hand-holding, we offer that alternative.
Well, it seems like especially when eating habits, it's such a big need to have somebody who's going to walk that journey with you more consistently for a holistic outlook and outcome. What is, to kind of roll back a little bit? Can you describe what the FODMap is for us, and how's that? When you're making suggestions, like what is an example of somebody you would see is like, hey, you eat this instead of that if you have intractable IBS, or how can you give us a basis of that?
Sure, sure. So the FODMAPs are fermentable carbohydrates. They are common in a lot of the foods that we eat. And what happens is that when you eat these fermentable carbohydrates, they're not broken down in the gut and absorbed like the rest of other nutrients are. The bacteria in the gut actually work on them, break them down, and there's a production of a whole amount of gas, and that causes the bloating, and then you have constipation, diarrhea, and all the symptoms of IBS. So what FODMAP itself stands for, it's an acronym for fermentable oligosaccharides, monooligosaccharides, disaccharides, and polyols. So that's what they say. It's a little bit of a handful, but that's what it actually stands for. And so I think a lot of people will find out that when they have symptoms after eating food, it actually is due to FODMAP. So, for example, a lot of people are intolerant of dairy, and there's a FODMAP there, disaccharide, which is lactose. And then, some people are intolerant of, believe it or not, of onion and garlic. That's a huge FODMAP trigger for many people. And even wheat and gluten-containing foods. Some people who think that they have gluten intolerance actually have an intolerance to fructans, which are FODMAPs that are found in wheat and other grains that have gluten. So they sometimes, they just know that, if I avoid these gluten-containing grains, I feel better. And it's actually because you might think it's because of the gluten, but it's actually because of the fructans. And now I'm not, talking about people who have celiac disease, which is true gluten allergy. And then you also have FODMAPs, like you find them in fruits, like apples, fructose, and fructose is also a huge FODMAP. So some people find out they eat fruits, they eat apples, they have a reaction. And so it can be a confusing diet because there's so many. You're not just eliminating one thing; you're eliminating so many things, and then you have to be careful about your portion sizes and whatnot. And so some people, they can do it on their own. Some people can do it with a dietitian, but for a lot of people, they can't necessarily do it on their own, and it's not that easy to find a dietitian, much less a dietitian who is trained in the FODMAP diet. So many dietitians, you would think that all dietitians are all the same, but dietitians also have specialties, and not all dietitians, even GI dietitians, have a good understanding of the FODMAP diet. And so we have all our clinicians, dietitians are trained in the low FODMAP diet and have had experience using it.
So interesting. Dr. Onyx, you walked us through how the patient works with you on your website and, using your products, but how would providers benefit from working with Casa de Sante?
Yeah, so we think we provide a huge benefit for providers, because a lot of patients initially go to their primary care physician and then maybe even get referred to a gastroenterologist when they're not getting better. I remember I was in the doctor's lounge called Samuel a while ago, and there was a question asked, like, what was the most tricky thing? What's the worst thing that you hate dealing with? A condition that you hate dealing in patients, and quite a few people said bloating, because it can be so difficult and time consuming for a doctor to get to the bottom of it. And in the healthcare paradigm that we have right now, where people just have 15 minutes, 20 minutes, to see their doctor, there's just not enough time. And we offer doctors an off-ramp whereby, instead of just telling their patients, which a lot of providers do, just this go on the low FODMAP diet, and the patient's like, well, how do I do it? It's like, well, go Google it. So we offer that we offer them a place to send their patients where they can have help and be led through the low FODMap diet, have their questions answered, and instead of going to the ER or having problems, waiting to schedule an appointment with a gastroenterologist, which could take quite a while to happen, come to us and have a quick appointment in a short period of time, and then work with clinicians to get relief from their symptoms.
Awesome. So what's next for Casa de Sante?
So we're really excited. Well, we just launched the virtual gut clinic, and we've gotten a lot of positive response from our customers. So we're looking to expand. Right now, we're self-pay. We want to take insurance because we've had quite a few inquiries about that. So we're looking in the next few months to ramp up, take insurance, partner with more providers, employers, wellness, because we see the opportunity to offer employers a way to provide a benefit to their patients, to their employees with IBS, so as to reduce absenteeism and just make for a better quality of life for those employees. So we're looking to ramp up our partnerships in the next few months and take insurance, continue, getting feedback from our patients and growing the service.
That's really great. Could you kind of to wrap up, what do the partnerships look like outside of looking at the insurers specifically? What other partners are you looking for on the provider side? Or I'm sure there's a lot of clinics where they just have like a booming need for access where they might have to offload or not see patients versus leveraging you all. So what do those partners look like to kind of wrap up?
Yeah, exactly. So we're looking to partner with providers such as primary care physicians and even some nutritionists and some gastroenterologists. So we're in terms of referrals. So that would be referrals, and we would work closely with the referring providers, give them feedback about how their patients are doing, and go on give them continuous information about their patients so they don't lose touch with their patients. In terms of the wellness and employees, like self-insured businesses and wellness coordinators and companies, we're looking into offering that as a benefit. Especially, we see low FODMap coaching and support as a huge need. For both the providers and the wellness and the employer plans. We're also looking into working with hospitals and health systems down the road to provide an option for their patients as well, if they need more support for their IBS. So those are the sort of providers that we're looking to work with. Maybe hospital pilots in future, so as we can get more data on the cost savings as well as the benefits of a virtual IBS clinic.
Amazing. Dr. Onyx, thank you so much for all the information you provided today. As we know, America deals with so many different issues in the dietary area. And so, we really appreciate the work that you're doing. And thank you so much for joining us today.
Thanks for having me on. It was a pleasure.